Hi, my name is Matthew Lee. I'm a general dentist practicing here in Denver, Colorado. As for where I'm from, I consider myself from Colorado. I was actually born in St. Louis, Missouri, but I'd moved to Colorado basically right away, and so I've been here ever since for a pretty long time. How do I typically start my mornings? My mornings usually start for me in prayer. I'm really big into making sure that I know why and I know for what purpose I'm doing what I'm doing. And so for me, it really helps me get my headspace in kind of the right environment before I do start my day at work. Also just a practical thing, because I'm a dentist and I'm always hunched over all the time, my shoulders are always hurting, and so before I go to work, I always hang from a pull-up bar just to make sure I can try to lengthen out that shoulder socket a little bit, make sure I can practice pain-free. How do I relax after a long day of work? Well, I'm a big Nuggets fan, and so I really enjoy watching basketball during the season. Me and my wife like to hang out at home and watch some TV and unwind that way. Sometimes we go to the gym. Lots of fun stuff to do in Colorado as well after work to unwind. What are your hobbies? I'm a really big snowboarder, so I really enjoy the mountains, and the big reason why I came back to Colorado after I graduated college was I liked the things that Colorado had to offer. Biggest one being snowboarding, and so whenever it's wintertime, I'm always up in the mountains and either going with myself, my family, or teaching some friends from church. Who was my role model growing up? My biggest role model growing up was my grandfather. My grandfather was someone who grew up during the Japanese occupation in Korea. And he would always tell me all these funny stories, but deep down I knew that he lived a very difficult life, and seeing how he, one, lived a very difficult life, but two, was still just so filled with life and joy and energy. And he was just so passionate about so many different things, and he really shared that passion and love for life with me. And so I had a lot of role models, but for him, that was one of those things that I really, really looked up to, was just his joy for life, and just being really able to appreciate all the things that he got to experience. What else motivates you? A lot of things motivate me. I'm a pretty fun, motivated person, so if it seems fun, I'll be pretty motivated to do it. Work can be fun, so that's one thing, but work's not always fun. What also motivates me when work isn't fun, when it isn't a fun motivation thing, is helping people. I think when we're in a healthcare provider role, whenever we are treating people, trying to make their health, in my case, their oral health, just a little bit better, that for me brings a lot of joy, and that joy is why kind of what motivates me to keep on pursuing and keep on learning and keep on doing what I'm doing. What is one thing that I want people to know about me? Something that's very, very important to me is my faith. I am someone who really, really tries to live out what I believe is a higher calling in my life, and I try to do that in every aspect of my life. And so I'm very involved in my local church, and I often love to host that church community at my home. And so my wife and I often host dinners basically every Sunday, just to get to know our church community a little bit better. What specialty am I in and why? So I'm a dentist. I did not go to medical school, dental school, whole different thing. And why did I do dentistry? So I actually grew up in a doctor dad and a dentist mom household, and so I was always thinking, man, I have so many choices. I can either be a real doctor, or like a mouth doctor. And it was kind of tough for me to make a choice, but I think one of the things that really kind of helped me solidify my decision was kind of knowing myself. And as I was growing up, I know that I'm someone that has, a more finite emotional capacity. And so I find it very, very difficult knowing that people that I know or patients I've worked on might have passed away, or maybe seeing their conditions worse. And so this sounds kind of silly. A big reason why I chose dentistry was the stakes are just so much lower. It's very infrequent where you have a problem in the chair. Whereas, I have buddies in EM, emergency medicine right now, and, they see death on a daily basis. I just thought that for me and for what I want in my life and the direction that I'm heading, I would rather save my emotional capacity and not have to burn all that at work. And so that was a big push for me for why I chose the specialty, I guess, of dentistry. What types of patients do you see? At the practice that I work at, it is a private practice, but we are also one of the few practices in the area that we're located in that accepts Medicaid, which is our local government health subsidized insurance. And so we see a wide range of patients from all different ethnicities. And specifically in Aurora, Colorado, we have a very large refugee population. So I get to experience lots of different cultures, lots of different socioeconomic backgrounds. We get the occasional Korean patient because I am Korean, and so sometimes they seek that kinship in their doctors as well. But kind of patients all over the board in terms of ethnic, social, economic backgrounds. Sharing a memorable experience with a patient, I always like to think back on the good times. I'm generally a positive person, but there's one case when I first started practicing that is very memorable, and it's not for the good reasons. He was a really nice Korean pastor, and he came to me, and his condition wasn't ideal. And because he was a little bit older and didn't speak a lot of English, there was a little bit of a communication barrier because I only speak English even though I look Korean. Anywho, the reason why this is a really memorable experience is because this is one of those experiences where the way that I handled the case wasn't ideal. He was just looking for something to essentially stop the pain in his front teeth. And I was thinking, oh, he wants me to do a full aesthetic rehab. He wants me to change the appearance of all the front teeth. And it ended up being this very long ordeal where I feel like the expectations that he had for his doctor and the expectations that I had for the patient were very, very different. I've since learned from, my mistakes earlier, but that was definitely something that really sticks with me to this day, is making sure that when communicating with patients that you're kind of both on the same page. I don't want to necessarily put on my patients what I want from my mouth or from my family's mouth, because they might be looking for something different. They might just be looking for something more functional and less aesthetic. And some people kind of on the opposite end are looking for something more aesthetic and not necessarily as functional. And so the communication is something that I think is super, super important between a doctor and patient. Some traits that I think make a good healthcare provider, especially in my field in dentistry, is going to be being very compassionate. Dentistry is a field where it's very, very easy to get clouded by the numbers, to get clouded by the money, and to chase the money instead of helping people, And because a lot of people, they come to you and they put all their trust in you, it's just super, super important that as a doctor that you have compassion, you put their interests ahead of all the tempting things of like, hey, you come in, I could do a filling, which I think is the more conservative option, but a crown makes more money. It really takes a lot of compassion, a lot of truth, and a lot of really seeking your patient's highest good to make sure that you're choosing their best interest every single time. And it's one of those things where if a patient puts all their trust in you, you want to be worthy of that trust, and you also want to do good by them and treat every single patient as if they were your family. And so I think that's one of those things that's super, super important, at least in our field, in the field of oral health, dental medicine, or just teeth dentistry, is just being very compassionate and also being very truthful in the work that you do. What aspects do I find the most challenging? I guess this kind of ties into what I previously said. I think the biggest challenge in dentistry is going to be making sure the expectations of the doctor and the expectations of the patients are kind of aligned. So making sure that open dialogue is always there, that what the patients are looking for and your professional opinion as well are both kind of intermingled, because some patients are like, I only want to get my front teeth fixed, but their back teeth need to get fixed first because they have some sort of cavities or caries or periodontal disease. But you can't necessarily just listen to what the patients want. But at the same time, you also have to hear what their end goals are. And so I think communication is definitely very difficult and also something very, very important. In terms of what I find the most rewarding, this is going to sound a little bit shallow, but I love when patients smile after I do work on them. Before I was a dentist, I was a painter. So I was a painter down in Houston, Texas, and that's what I did my undergraduate studies on. And so I'm very, very drawn to what the appearance is, and not only what the appearance is when they first come in, but what the appearance could be after they leave my chair. And so what brings me the most satisfaction is a patient that comes in and they don't like the appearance, and after leaving, they're so filled with joy with the work that I was able to do in the chair. And so for me, that brings me the most joy, because you're not only addressing a functional need, but also a mental health need as well, because a lot of times your confidence is so tied to your appearance, and teeth are part of that appearance. In ways that I collaborate with other healthcare providers, predominantly because I'm in the dental field, the doctors, physicians that I most often work with are going to be ENT surgeons, because there are some sort of crossover between airway in the dental world, as well as airway in the ENT realm, as well as with orthodontics and oral maxillofacial surgery as well. So it is a little bit of a multidisciplinary thing whenever you are working with airway. And so I am one cog in the wheel whenever patients do present with an airway problem. And generally, you see your dentist a bit more frequently than you see your physicians. And so we're oftentimes the people that will recognize and kind of point patients in the direction they need to go if we do find signs or symptoms of airway problems. How do I build trust with patients in my care? The way that I like to build trust with patients is honestly having a good sit-down conversation. It's really, really hard to trust someone that you haven't talked to. And it's even more so hard to have trust in someone where you can't even see their face. You know, most of the time I'm wearing masks, I'm wearing my surgical loops, I'm wearing my scrub cap, so they don't know what I look like. And even though I don't take all that stuff off whenever I talk to them, I think it's important that they at least know the sound of my voice, that they can at least converse with me, and that we can both get on the same page. You know, having a good conversation does multiple things. Building trust is one of them. Communication is another thing. And just making sure that you're able to establish a good relationship between provider and patient that's going to be able to benefit, you know, both sides. Any special tips or tricks when caring for patients? A lot of patients, they look at me and they're like, wow, you're really, really young. And so, you know, it kind of goes a lot of different ways with this little question right here. My little special tip or trick for talking with patients that see their provider and like, wow, you're super, super young. And I always like to think of it this way. When you're younger, your body's feeling pretty good. Your hands are probably a little bit more steady, and don't you want your surgeon having really steady hands? Now, I don't do too many big surgeries nowadays, but I always like to crack jokes as well. Just trying to make sure I can, you know, win trust, win some brownie points by just being generally approachable. I guess I don't really have any good like special tip or trick for patients looking at me and saying, wow, you're a really young provider, I'm not sure if I can trust you, but I think it's one of those things that takes a lot to build rapport. So no special tricks, I guess, no easy way out. What is a challenge facing healthcare professionals today? I guess I'm going to be more specific to the field that I'm in. I think the big thing that is facing a lot of dentists is kind of bleeding into the general health of the population, that starts as a challenge of our practice or our profession is going to be opioids. You know, a lot of people get their wisdom teeth taken out. And when people get their wisdom teeth taken out, oftentimes doctors, they don't want to have to deal with the post-operative pain and sensitivity that often comes with the healing process. And so the old school way of dealing with it was like, hey, we take your wisdom teeth out, and then we're just going to give you some Percocet, or we're going to give you some Vicodin, or we're going to give you some other narcotic that is, you know, fairly addictive. And because of the wide amount of people that are, one, getting this procedure, there's a large amount of this medicine that is fairly addictive and fairly harmful going out into the general patient population. So I think that's one of those challenges that's currently facing our profession right now, is how to deal with the pain and post-operative care of a procedure that we do without harming not only an individual patient, but the patient population as a whole. One piece of advice that I would have for aspiring healthcare professionals is going to be to make sure that you really want to do what you're studying. I see it all the time where people go into dentistry because they say, oh wow, the lifestyle's really good. Oh man, the pay is super, super good. Oh, like I'm like kind of interested in sciences, but I don't want to be like a full surgeon, so I want to be like a mouth surgeon. The difficult part is if you really don't have that foundation of, oh, I'm really interested in serving people, I'm really interested in helping people, or I'm really interested in doing the thing that I'm doing, you see a lot of people that go into it for the wrong reasons burn out. How sad would it be if you spend all this time, all this money to become a dentist, to become a doctor, to become a physician, and only to work for 6 months to a year and realize that it really isn't for me. And so I really think it's important that while you're in those preliminary stages, make sure that what you're looking for in your profession also happens to kind of mix well with, that what you're looking for in your profession mixes well with what the profession can provide. As well as, look at other mentors and stuff and talk to people that are older and wiser and maybe have gone through a little bit more life experience and ask them to be honest and say, hey, do you think I would be a good fit for this profession? And so I think it's always good to learn from people that have a few more life experiences than you do.